Hey, good morning, everyone, and welcome back to our virtual conclave on future of healthcare. In the morning, we heard our three keynote speakers speak, and then we had Ajaya unveil the real-time healthcare solution. And today we have a very distinguished panel with us, which we are going to talk about revolutionizing healthcare for superior patient care. So before we start, a quick round of introductions. Let me introduce myself. My name is K. Nandakumar. I'm the General Manager for Safety and Productivity Solutions Business for India. We have with us Deepak Venugopal, who's the Regional Chief Operating Officer from Manipal. I have Rajinish Menon, who's the founder and CEO of Sukino. I have Dhruv Joshi with me, who's a co-founder of Cloud Physician. And I have Charbel, who's my colleague, Director of Offering Management. So quickly over to you, Charbel, for a quick round of introduction.
Good morning, good day, everyone. Thank you, Nanda, for the introduction. My name is Charbel, and I have been in the healthcare industry for around 17 years. I have an engineering background, executive MBA, and I'm a PhD candidate in the context of value-based healthcare. I'm currently leading the offering management and commercial excellence for the Honeywell Intelligent Life Care. And this business unit is within the safety and productivity business of Honeywell, focused on healthcare and improving what we can do in terms of productivity, safety, and efficiency for care organizations. Thank you again for this event, and thank you for having me in this panel.
Hey, thank you, Charbel. Deepak, over to you.
Thanks, Nandu, for stitching this up together, the Honeywell team as well. So it's good to be a part of this panel discussion. So my name is Deepak. I have been working as a regional chief operating officer for the Manipal hospital network in their hospitals in Bangalore, Mysore, and Salem. So as a part of my responsibility, we have 11 units in these cities, which I am responsible for the operations and the day-to-day operations, etc. So as a healthcare professional for most of my working career, so almost 23, 24 years of work experience in this space. Looking forward to the next 15, 20 minutes where we can all come together and share our ideas. So thanks for getting me here.
Hey, thank you, Deepak, and welcome. Over to you, Rajinish.
Thank you, Nandakumar, and good to meet all my fellow panelists. My name is Rajinish, and I'm the founder of a company named Sukino Healthcare. Sukino is a company that is involved in providing continuum of care for patients who suffer from chronic ailments. We have been in existence since about 5 to 6 years across Bangalore and Kochi, have close to about 250 odd beds, and we are very active home care team as well, supporting the continuum of care. We are into the core service provision, for healthcare, where we use technology to kind of aid the provision of healthcare for our patients. I'm looking forward to the discussion.
Hey, thank you, Rajinish. Dhruv, what do you?
Hello, everyone, and it's a pleasure to be here. My name is Dhruv Joshi. I'm a physician by training with a specialization in pulmonary medicine and intensive care. I co-founded and I run a company called Cloud Physician, where we leverage our proprietary technology platform to connect hospital ICUs to our team of ICU specialist doctors, enabling hospitals to optimally manage their critically ill patients. We do this across the country, and today we're supporting about 40 hospitals across 14 states in the country in India. We're based in Bangalore and spanning about a network of around 400 ICU beds. Pleasure to be here, and I look forward to the discussion.
Hey, thank you. So, very honored to kind of chair the session today and have really set of people who have spent collectively, I think we have close to 100 years of experience in healthcare. So really nice to have a very seasoned team today. So let me just set a context in terms of how the last 2 years have been and how healthcare has kind of been over the last 2 years. I think the one industry that has really been pushed enough in the last 2 years has been the healthcare sector. And the pandemic kind of really tested the availability of hospitals, availability of doctors, availability of caregivers. And what has happened is everyone wanted to scale up quickly. And we all realized that to set up hospitals or have doctors or nurses come out from colleges is not so very easy, right? It's a little long-term solution that we need to work on. And naturally, it takes time, well as a lot of investments that needs to go in. And that's where the very critical part of technology comes into play. And the whole discussion around what Honeywell is trying to do is see how can we help the healthcare segment in driving superior healthcare or patient care by moving on to technology aided solutions, kind of take technology as one of the key pillars for growth. So that's in terms of the context, in terms of where we are and how we want the discussion, or how we look at the discussion for today. So before, what I would do is I would like to start with asking Deepak, how has the last 2 years been, maybe pre and post pandemic? What's happened in the healthcare sector? What has been the impact on patient care?
Well, that's a big question to answer, Nandu. I mean, especially with the first wave, second waves, and the COVID learning that all of us have taken in our personal and professional lives. But I mean, if I had to look at it from a perspective of the buying behavior of a patient or the consumer, I think that's the major shift that has happened in the last few months, few years, wherein a patient is willing to access his treating doctor through alternate forms of technology, wherein this whole brick and mortar physical touch model, which at one point of time was perceived as the only way to transact healthcare, has definitely changed. I mean, I think as large hospital players that we saw video consultations reach new numbers of heights during the COVID period. And there were quality consultations happening for specialties like a physician, maybe a dermatologist, maybe a surgeon who actually was having these meaningful dialogues with his patient on a video call on through technology platforms to start attending to the healthcare needs, which was otherwise not possible because the patient couldn't come out of his house, right? So I think that has been one major shift, which I think all of us have begun to realize. Number two, I think even if you look at it from a overall perception towards health for consumers and patients today, I think everybody is so much more educated about realizing why healthcare is what it is. People are talking about COVID tests, they're talking about antibodies, they're talking about the blood biochemical parameters. I think masks and hand hygiene, etc. Everything has now become kind of more relevant for the day-to-day life of consumers, which of course is affecting a lot of access to information and content, for people to know what is relevant for them. How do I kind of measure myself on a daily basis in terms of my immunity? How do I kind of keep myself fit and healthy? I think, the entire transitioning towards wellness in this period of illness has been also a very nice transitioning, which I think a lot of us have noticed, I'm sure, because today, I think a health checkup, preventive checkups, etc., which was more of an annual routine, which most of the companies used to do just to cover up like a check in the box kind of a concept, has changed. Where I think genuinely people want to know that are their parameters strong enough to keep them healthy. So I think that is another key transition in my mind, which has linked in a lot of technological disruption. Again, like some of our keynote speakers spoke about earlier too, that what is the digital disruption in healthcare today. I think that becomes very relevant. So a lot of these app-based solutions, people keeping their health records in easy access. I mean, if you remember those old files which people used to carry around. Today, there are ways that I go to a doctor, I say that this is my last readings. What do you think about it, right? I mean, so that has been another strong technology, focus. And I think the last one before I take a pause and invite comments from my fellow panelists is about this entire piece around out of home practice. So I think I heard Rajinish speak about his business model, which is working so much around home care. I think even as players that we are into healthcare delivery, I mean, with quaternary care services being offered in terms of transplantations and high-end work, we still see the need of us to reach out to our patients in their home settings, because that is where comfort lies, because they feel and they realize, and they've tasted healthcare also being delivered at their own home front. So whether it's a lab collection, doctors on call, nurses going and attending to the requirements, pharmacy being delivered. I think that again has been another huge place. So again, technology plays a major role in terms of getting them to stay fit, get treated in a hospital, and then of course digitally transact their continuum of care across the whole space. Would be the 2 or 3 key changes that I have been seeing. And again, one last point is that we have always, as hospital providers, we always take pride to see a crowded hospital. So the moment you come to a hospital, say it's a busy hospital, I think that as a definition is changing, because a smart hospital doesn't have to be busy. A lot of things can happen with patients being at home. You don't have to really meet a patient on a follow-up consult. You can do it over a phone call. So I think it's beginning to become a little more smarter in terms of the way we function, because infection control practices have increased. You really don't want everybody crowding in lifts or moving around the whole hospital lobby to show it's busy, but be smart enough to go more of appointed care, access your patient at the right time, and keep following up through a digital route or a technology route. So I think that would be a final comment, that hospitals are beginning to work much smarter as healthcare players, and are tying up with the larger ecosystem, which Rajinish and Dhruv and a lot of other players are bringing to the table. So overall, it's going to be a huge benefit for the patient for sure. Over to you, Nandu.
Hey, thanks, Deepak. Key points that you made, which I really like. One was around the busy hospital and smart hospital. Clearly, what today, after COVID, we realize really we have a phobia towards crowd, right? We don't want to see crowd, and especially when you go to a hospital, we really don't want to see more people there. So a smart hospital is truly one which is key that you spoke, and I agree completely with you in terms of the buying behavior, healthcare at home, and that kind of leads me to asking Rajinish, very different from a traditional hospital continuum care. How has it been for you, and how have you adopted to technology?
Well, the continuum care itself is a very new concept in India. When I started the Sukino about 5-6 years back, my first point was to evangelize this concept amongst the consultant itself. Not that they didn't know about it, but it's just that the concept in India, is it available? Do you do that? I mean, these are the kind of questions I was asked by the consultants, because they have seen this model, they've heard about this model, and they have, for some of them, also worked in such companies in the developed countries. So continuum of care, just to kind of speak a couple of words about it, it's a concept where people who need extended care, when I say extended care, it can be medical management care or it can be rehabilitative care, and in most cases it is the combination of both. This is where something is missed out. For example, if I to take the cardiovascular area, post a cardiac surgery, till date, and when I say till date, I don't mean today, but I'm talking in general, people are extremely scared to take even one step forward, thinking that they're going to be putting a lot of pressure on the heart and that can just rupture, right? It's a kind of misconception people have. Whereas in reality, a person who's had a cardiovascular surgery is supposed to do an endurance test, a stress test to see, and then so that he can reclaim his life back. And after all, you've done the surgery to reclaim a life back and not to go back in time, right? So the concept of continuum care is something that ensures that people understand that nothing is greatly lost. They can recoup whatever they've lost. And to that extent, both the medical management and rehabilitation goes hand in hand. Now, as part of continuum of care, the main aspect that we do is we take care of the treating physician's advices in treating the patient. So we don't do anything different. The patient is secure, safe, in that he gets a same treatment plan of the doctor. The doctor is now very assured that the treatment plan that he's advised is something that has been carried out over here. And thirdly, as a partner, even you can call ourselves as a concierge partner as well. We act as a bridge between the physician and the patient. whereby at any point in time, any sort of a movement has to be done, any sort of a care has to be provided, any care of a care has to be acknowledged, be transferred. All this is done by Sukino. So as a concept to land this in the initial days, it took about 3-4 years for me to land it. But now the good thing is that people understand it. Patients understand it. Again, thanks to Google and thanks to the Googleopathy that we see today, people understand what is rehabilitation, and they do come forward. You'll be surprised to know that majority of my patients come on their own after Googling about what Sukino does. They talk to the doctors, understand the concept better, then they come and visit us and they see how other patients have gotten better. So, the concept is unique. We are still pioneering it, and I think we have a long way to go. And this is where technology plays a very big role as well, because although we are in the core services element, the only way where we can mimic some of the clinical aspects of the hospital, but at the same time, if we have to provide the comfort of a home, what is very important is that we don't work like the Babu setup with a lot of people, but we work with minimal Babus, where the touch point with the patients is going to be higher order, but use technology as a backbone to kind of give out a lot of services. So that's the kind of a story we have had. That's the kind of story we believe in. We're going to be pioneering in the future as well.
A great, Rajinish. A completely new theme, right? Continuum care. When we met up the first time, and I really got to hear about it. But a lot of people are moving into it. They want it, and that's why I think the buying behavior that Deepak spoke about is coming into play.
Absolutely.
So let's move on to Dr. Dhruv. Doctor, by profession a doctor, now running a technology firm. How has it been? How has you been adopting to technology? What do you see as a future in this space? How are customers, patients, doctors looking at it?
Yeah, thanks for the opportunity, Nandakumar. Firstly, I'd like to just make a slight correction. I think it sounds very sexy to say you're a technology firm, but I'll tell you, healthcare delivery is complex. It's operationally complex, right? And technology in and of itself is not generally going to solve any of your problems. So we like to call ourselves more of a healthcare solution company. Yes, we are all about technology and completely technology enabled, but we realize that with delivery, especially in the space of high acuity care, there are so many touch points, so many stakeholders that it requires an operational framework for the technology to be successful. And that's where we've sort of come in and found our space. So I think when I think about what we're doing and why we set out to do what we're doing is just having been a healthcare provider for a long time, two things that were sort of apparent to me, and actually my co-founder Dilip was also a physician. One was the current construct of the hospitals as they stand today. Like Deepak also mentioned, needs to move towards working smarter, right? So I think you use one sort of trend that we find is that hospitals will work smarter in ensuring the optimal care for their patients and ensuring that they are sort of optimized in terms of how they work, and will move towards higher acuity care, procedural related care, and sort of then you have the entire continuum of care where Rajinish and home care and all of these sort of come in to ensure not just optimal outcomes for patients, but optimal experience, both for patients and for providers, right? So I think that's one thing that was obvious. The second was that, in the current construct of how healthcare delivery is done, there are so many gaps, right? So many gaps where technology can be leveraged to further streamline things. Everything from improving operational efficiency of hospitals to improving the quality of care and ensuring access at in a value-based manner for patients, right? So I think that was generally the theme behind which we decided to start Cloud Physician. But we also realized just putting together some technologies not going to solve this problem, but how do we create reimagine the way in which healthcare is delivered and marry technology, marry clinical services, put in an operational construct that will allow patients to get better quality of care, that will allow providers to get a better experience in delivering care, get administrators the operational efficiency in the hospitals that they need. And that's how cloud physician came about. Now, this is something that we started doing in 2017, and our domain expertise being in the critical care space. I'm an intensivist. We realized that we can do this in the ICU space. And we had been doing this for a couple of years till COVID was upon us. And then clearly the problem statement that we were dealing with was sort of, exacerbated significantly. Now, there's the low-hanging fruit where it's simple enough, right? Where you realize that, hey, you know what? There's COVID, there's a pandemic, you want to manage somebody remotely, you sort of have them dial in, and you can actually provide them the care that they need in the comfort of their home. That, I would say, that's the sort of low hanging fruit. But then how do you pervasively change the system and pervasively start incorporating technology in your operational workflows to really drive patient quality and the kind of operational efficiency that you need? Because at the end of the day, expertise is limited. People are going to be limited. Your best doctors are going to be at a few centers. The most trained people are going to be at a few places. And we clearly know that does not address public health at large. So how do you sort of ensure that you take care of patients that need access to the expertise, and yet do it in a value-based way by leveraging technology? I think that's been the journey that we've been on, and we've been doing this for a while. Of course, COVID has uh, brought about a fair amount of awareness about this. We've been able to demonstrate improved outcomes, demonstrated by everything from compliance to standard of care protocols to reduction in mortality rates. And also, what technology does, it just creates a framework of accountability which previously did not exist, right? So you don't really when you go into an airplane, you have a black box and you have everything here. You have an accountable system. In healthcare, very often you're actually going into similar sort of critical situations without that framework of accountability in place. And having technology there can actually ensure that we do that, to ensure better outcomes for patients. So that's been the journey so far, and it's been quite interesting.
Hey, thanks, Dhruv. Clearly, point that comes around is making sure operational efficiency is there and superior patient experience. So, Charbel, from an Honeywell perspective, you've looking at the healthcare space globally. You've heard our other panelists, so would like to hear your comments.
I heard a very in-depth analysis from Deepak in relation to how the COVID-19 had a positive impact on the healthcare. And this is where technology providers like Honeywell can come into the play. So if you think about an enhanced awareness of people accepting getting diagnosed remotely through telemedicine, remote patient monitoring, etc. So the first shift, this is a paradigm shift. And the doctors know that it took probably 10 years from telehealth technology existence until the adoption that you see today. And that was due to COVID-19, because the capacity imbalance forced the care organizations into deploying this very fast to cope with what's happening in COVID. So the awareness accelerated the adoption of new technologies. And it's mentioned already that if you look at the online consultation that happened the last 1 year or 2 years, compared to the last 10 years, the number is self-explanatory. So for us, from a technology provider, to implement that, you need technology. You need a two-end of communication that connects the patient and the care organization and the care team within the care organization. And that requires a complicated, synchronized workflow optimization Dhruv mentioned this, and this is very, very much right. You might think that this is a straightforward approach. It's not, and it might differ from organization to organization, from hospital to hospital. What we're doing, we are, as much as we can, trying to localize the technology that we have in terms of processes and workflow to be adaptive by the local communities and local care organization protocols and processes based on the technical capabilities that we have in terms of software development, integration with enabling partners, because that's another element of the technology. Today, when you think about what Rajinish service has been provided, and going back to Deepak point about the necessity of electronic medical record instead of the papers and the records paper-based, so we need, as a technology provider, to be in a connection with the enabling partners in the healthcare ecosystem, and this is what we're doing. So if you look at the real-time health system, and that in the keynote Ajaya spoke about. So this is a combination of ecosystem integration with the hospital information system and medical record, plus an vertical integration throughout the communication channels in order to reach the patient wherever they are. And the outcome is for physicians and doctors in a hospital to be able monitoring vital signs, EKG measurements for patients that are outside. So this is another shift in the awareness that Rajinish spoke about. So we're trying to take through technology the awareness that been already provided or forced through the pandemic in order to enhance the consumer behavior toward the new care service model that is in place today. And this is a win-win situation for everyone, for care organizations, for the care team, for the patient, for technology providers. And yes, I agree with Dhruv. The definition of a smart hospital changed. So smart hospital today is not the hospital that has extensive technologies that few people know how to use in a hospital. To more, a smart hospital would be, this is the hospital where you spend less amount of time as a patient. You go in, you go out very fast, the minimum amount of time. So this is where I think from the RTHS, from the internal communication, nurse call system advanced, connected all together with the other ecosystem solutions that would participate as a supporting pillar to deliver the new post-COVID care service model.
I agree, Charbel. So kind of what comes across the discussion is technology is imperative. We need to adopt it. And that's what's going to kind of give you better operational efficiencies and better, superior patient care, and especially knowing that we have challenges. But the big question is around adoption. So a quick one word from each of the panelists in terms of what do you think is a major challenge in adopting to technology? Is there something that's stopping us, or it's an imperative we just got to go? So quickly, Deepak, starting with you. What's your take on adoption of technology?
So I think Charbel, as well as all of us have been talking about this. That it's more of an industry approach in my view, Nandakumar. I think today, if you had to pull out any of these car-selling auto magazines, right, and they would give you data on number of Mercedes that was sold in the month of, say, September. And if I had to say how many cardiac surgeries happened, say, in the month of September in the city of Bangalore, I wouldn't have a repository to refer to, right? I think it is so much to do with the industry to kind of get into this platform wherein each of the ecosystem players start contributing it either as a mandate or as a patient services, that everybody starts talking to each other. So I think that's where the adoption becomes a bit of an issue, because of course the government is pushing now a digital health initiative wherein it's trying to mandate that all of us. I mean, vaccination is a great example. I think today You can port your vaccination records across multiple segments, right? But when it comes to say somebody who has been a part of Dhruv's treatment plan in his entity, if they had to come to a Manipal tomorrow, I mean, how does that data talk to each other? How does it go to say a rehab program with Rajinish on the other end? I think that's where we are going to be fighting our little battles to sort this out, because it is still a industry which does believe that it's working in silos, if there's a right word. But as a large network, when we have 27 hospitals today, it's a little easier for us because we can network the entire patient journey through these hospitals, through these different episodes of treatment that they come to. But I think that's something which we'll have to address. But I wouldn't call it much of a challenge, but I think it's a problem area we all need to solve. But it's really exciting times ahead for healthcare, in my view, Nandu, and I think we're all looking forward to be a part of this change, because if you don't, we'll perish soon. So we have to adopt anyways.
Hey, thanks, Deepak. Rajinish, your comments?
On challenges, Nandu, the biggest challenge, and I echo kind of what Dhruv said earlier. It's not about putting all technologies into one place and just say, okay, here's something very good technologies over here, start adopting it. It's not going to happen that way. What starts with from day one is that it's a patient experience journey, right? That is something that needs to be mapped out. And you need to take baby steps over here. You don't have to necessarily go out and buy all the solutions and then say that we're a technology-focused service company or something like that. For us, from day one, it has always been, how do you map the patient journey from the hospital to the home, or from home to the hospital, and then to our center for caring. So to that extent, you talk of technology at the back end, which will keep the processes very simple. Matters like CRM, which is very, very common in the enterprise segments, bringing that over here into its full entirety itself is a very, very great thing that kind of improves the back-end processes and also the patient outcomes to a large extent from a concierge perspective. Second is, of course, the various tools available from the cases of, say, augmented reality or artificial intelligence, which can talk to various other systems of startups. We kind of incubate a lot of startups in our company, where we try to kind of help see to it that some of the solutions that are good for rehabilitation, recuperation are brought together. They can talk to each other. How do you take smarter decisions, and how can you communicate those smarter decisions in real time with the treating physicians so that the patient outcomes will improve? So that is the second element, which has come to the maintenance of it. And third, of course, is predictability. Can you predict what is going to happen next? Because you have all these fantastic solutions which monitors the vitals and all that. But there's no point in getting a postman kind of technology solution. You need a solution which will harness the data available and then tell you with reasonable certainty that this is something that's a likely outcome of this particular patient, and this particular patient has to be taken care of this manner. For me, technology has played that kind of a role, and will always play that kind of a role. But the rest of the noise is something that we need to cut off, which we have successfully done so far. But it's a three-part journey. The pre, which is the journey itself captured via the backend CRM, then the data mining that we currently do, and then the predictability tools that we're building in. To us, technology is that.
Hey, thank you, Rajnish. I think very valid point, right? Taking those baby steps and weaving that together. So, Dhruv, adoption.
Yeah, I think you bring what you're talking about is where the rubber hits the road, Nandakumar, at the end of the day, right? That's what we're talking about. So I think it's we can sort of talk about the 30,000-foot view, and it's all rosy and hunky dory, and we know that's the direction we need to go in. That's the vision, etc. All of that is already established. So now, how do we actually move that needle in that direction? Is where the rubber hits the road, and I think it's really important, concept, and we should think about this a little bit. I think it's incumbent both on the healthcare providers, the solution providers, to be able to prioritize this movement, right? Because see, at the end of the day, Deepak's managing 11 hospitals. He's got a lot of priorities. There's a lot of established ways of functioning of doctors, nurses, etc. Now you try and change that around. That's not an easy task. That is operationally very, very complex, right? And that applies to any hospital or any healthcare provider, right? Anywhere. And so how do you make this a priority, understanding that this is going to give you value at the end of the day, right? So now that is, I think it comes down to leadership at both levels. Solution providers like us, we need to be able to convince, any healthcare provider, whether it's Deepak or somebody else, that, you're going to see value here. This is the value you see in the short term, in the medium term, in the long term. But this is what you need to do to realize that value. And this is what you need to prioritize. And that's going to involve a fair bit, right? So it's incumbent upon us, for example, to ensure the user experience for providers and patients is seamless, because otherwise, it's going to be a problem for any healthcare leader to tell doctors and nurses, change the way you're doing things. If his patient or his doctor or his nurse does not like the way. So that's on us. At the same time, it's incumbent on the leadership at the provider, at the healthcare providers to realize that this is a important enough priority for us to focus on, that we're going to actually put some muscle behind it, right? We're going to make this a priority. We're going to let our team know. Let's create an atmosphere and an environment where we sort of bring everybody on board, but don't just do it in the sense that, yeah, we'll try it out, we'll see how it goes, and 2 days later, if something happens, we'll sort of shelve it. That's not really making this a priority. So I think there's a fair bit of change that needs to take place, and it needs to come from all ends, right? So whether Honeywell's building the solutions, like how do you ensure that you make it easier for providers to adopt that solution, and providers to sort of realize that this is a priority and I need to put some muscle in this. I know I've got things to worry about. I know that there's established things that things are going, and perhaps my month end and quarter end of what I'm doing is a priority number one. But how do I, at the same time, make this a priority to ensure that 3 months, 6 months, 5 years, 10 years down the line, I am providing the patients what I need to. So I think that's where the adoption piece comes in. And I think everybody needs to understand that this is where the rubber hits the road, and this is it's incumbent on everybody to sort of step up and be like, okay, there's value in this, and I think we need to demonstrate the value, and not just you can't just say that, hey, do this, and 5 years, 10 years down the line you'll benefit. You actually need to show people that there's a trajectory here. This is what you can expect in 3 months, in 6 months, in 12 months, in 24, in 5 years, and in 10 years. It's really important if we are going to see this adoption take place. It's going to be important for us to bring everybody on board.
True. I think the point is setting up key milestones for the ecosystem to kind of progress, and how do we show value in each of those milestones is going to be key. And Charbel, last to you, we have less time, but quick take from your end.
What I would like to say, generally speaking, we are ready from a technology standpoint to bring the extensive years that we had in operational efficiency, data intelligence, to the extent of what the healthcare vertical requires today, from all the other industries that it's already implemented there. So if you talk oil and gas, we have been there for data intelligence since ever. And if you talk about oil and gas, then e-commerce for the last 15 years, Honeywell, from a technology's point of view, was one of the main pillars pushing this solution to the globe as well. Today, we are, and this panel is part of what we are doing, listening to our counterparts from technology providers, and for care organization, care team providers, the service providers, to listen what is their actual need today, what is their capabilities, at the same time convert that into the technology modeling that would serve the exact need that they are looking at today and for the next 10 years. The positive side of it, and again, that's a very inspirational thing, is that you can see out of something which is so bad, the COVID-19, you can see that it has some positive impact, and this impact will definitely has a long-term positive impact on the general population health management. if you're talking chronic disease management, remote patient management, all of this, that will enhance the person well-being. After all, we are all patients. You are born in a hospital and until the last day of your life. So you start consuming healthcare from 0 day of your life. So today we are ready to convert the required steps defined by care organization, healthcare leaders, into actual technology that would deliver the value intended, both at the patient level in terms of care and also on the economic performance of the hospitals themselves and care organizations.
Hey, thank you, Charbel. So, really coming to the end of the discussion, I think the biggest takeaway for me, or for most of us, would be one: technology is clearly a step that we all need to take. I think, but as we all spoke about adoption, it's going to be key that we start taking those baby steps. And I think today is a day when Honeywell has taken that baby step in India around the RTHS vision that we have in monitoring real-time healthcare. And I think going forward, as most of you said, right, it's about integrating the various facets of healthcare into one and kind of get a solution approach. And that's where the ecosystem we spoke about. How do you develop that ecosystem that would adopt to technology? So clearly, from Honeywell's standpoint, I think we are ready for it. As Charbel said, we have started working in the direction, and hopefully, with partnering with all the various stakeholders, kind of build a very good, healthy healthcare ecosystem for superior patient care. So with that closing comments, I really thank each of my panelists, Deepak, Rajinish, Dhruv, Charbel. Thank you for taking the time out, and really appreciate for your good, valuable insights. So thank you. With that, see you.
Thank you.